On kids visiting hospitals, not the only big step that Lee Health is taking to deal with the flu right now. This graph is showing flu cases in Lee Health facilities. That's the blue and the green bars, and then the red line is showing last year's cases. And if you take a close look at these numbers, you can see that flu season peaked much later with fewer cases last year. But Lee County's not the only one dealing with this heavy flu season. Here's an updated version of what the Centers for Disease Control is tracking now when it comes to the flu. This shows the progression of infections in each state. Any brown states are dealing with flu in at least half of the state right now. And as you can see, nearly the whole country is seeing the level of highest infection from the flu. So you might be thinking, can I still get my flu shot now that I know all this? 400 Corners' Michael Cadigan talking to the experts to find out for you. Michael?
Patrick, the flu shot protects you from strains of the virus that are going to be the most common for that particular season. Besides the shot, a local pharmacist helped separate fact from fiction to help ease some of your concerns at home. Local pharmacies filling out prescriptions as people try to avoid being a part of mounting flu cases.
I'm aware of it, and I guess that's the best way to be. I do know a lot of people who have gotten really ill so far this year.
TJ DePola is the pharmacist in charge over at Cypress Pharmacy in Fort Myers. He says it's the busiest he's seen in over a decade.
It's been a very heavy flu season. You know, it's continued. It onset early in the season, and it just continued. There hasn't been a break with it yet.
Hitting our area hard because of so many people flying in and visiting, bringing in strains of flu along with their luggage.
It's tough because you have so much tourism here that they're bringing different strains from all over the country, and that makes it difficult to treat.
Difficult, but hope is not lost. It's not too late to get the flu shot.
A lot of doctors are recommending if you have not got the flu shot to get the flu shot.
The flu mist is another option, but not as effective as the shot. If you do come down with the flu, getting Tamiflu might be a bit trickier. There's a shortage thanks to the demand. DePola says not to panic, just make some calls to see who has it in stock.
But it's worth getting it to treat it rather than just letting it go altogether and hoping it goes away on its own.
Waiting isn't the approach you want to take here. You have a 72-hour window to knock out the flu, but any longer than that and you're going to have to treat the symptoms. And speaking of the symptoms, you should keep an eye out for
full body aches, the cough, the fever. You know, fever's a big one to look for. You know, if you all of a sudden spike a fever and you're getting those symptoms, it is tough for people to distinguish between flu and a cold.
Masks might be the go-to for some, but good old hand washing is your best bet.
I wouldn't panic. I would just be very, very diligent as far as washing your hands, touching door handles, Purell if you do touch a door handle afterwards.
It's important to not let your flu symptoms linger. You run the risk of the flu turning into pneumonia. Michael Cadigan, Fox 4, in your corner.
All right, thank you so much, Michael. Now, what if you didn't have to get the flu shot every single year, based on the strain that they're expecting? Doctors at UCF in Orlando now trying to create a lifelong vaccine so you get one shot and you're done. They want to create this vaccine that has a long-term memory for certain aspects of the flu virus that are always present, even when the strain itself changes. And that vaccine could last a lifetime rather than just a season.
A flu shot that, number one, wouldn't require prediction, and number two, would give you stable, long-term immunity throughout your life. And that's why a universal vaccine would be so revolutionary, is we would not have to worry about that as much.
But researchers say a lifelong vaccine is still about 10 years away. And that could eventually, though, make the flu a medical afterthought. Can you imagine? All right, so if you don't get that flu shot or if it doesn't work and somebody in your family is diagnosed with the flu, you have a choice. Should you give them Tamiflu? Well, listen to this. This family in Texas says the side effects on their 6-year-old who took the drug were stunning. Hallucinations, running away from school, and an attempt, they believe, to hurt herself.
Second story window was opened, which was in her bedroom, and she was used her desk to climb up onto it, and then she was about to jump out the window when my wife came up and grabbed her.
Her parents took her to the hospital where a doctor informed them that those nervous system problems can include psychosis and are a very rare side effect of Tamiflu. It's written in the fine print right there on the label, and doctors say there's always a chance of side effects with any drug. Doctors say the side effects should be only temporary in the case of Tamiflu. The girl's parents say they've written a letter to the FDA to let the agency know what happened.
Well, it turned out to be a beautiful afternoon here across southwest Florida with sunny skies and temperatures reaching the lower 70s this afternoon. Winds were lighter. Perfect day to be outside, and that's where we stand right now. Temperatures are comfortable. But take a look at this. We have a freeze watch in effect, not for tonight, but for tomorrow night. Inland Sarasota and DeSoto counties. We could be looking at temperatures falling near freezing in some areas here by the time we head towards Thursday morning. I'll let you know which areas have the best chance of those freezing temperatures in your Storm Shield forecast coming up in about 10 minutes.
All right, thank you, Derek. And with that cold weather on the way, Charlotte County is now set to open some cold weather shelters tomorrow night. There's one at the Homeless Coalition building on Kennesaw Street. It's going to be open at 6:30 p.m. and then it'll close at 8 o'clock the next morning. The American Red Cross will also be helping the shelter. They're going to be providing cots and blankets to anyone who needs them. A woman arrested in a hit-and-run crash that sent an 8-year-old boy to the hospital. Happened in Cape Coral. Police say Laura Wood hit the boy while he was riding his scooter. This was breaking news.